afternoon, everybody, and welcome to this third discussion as part of the Science and Society strand, which is called Health versus Choice, the Vaccination Debate. My name is Ellie Lee. I'm an academic working at the University of Kent, where I direct a research centre called the Centre for Parenting Culture Studies. The reasons I got interested in it beyond what everybody else, might have been doing, in the sense of just knowing that this is generally an important area of discussion, is that actually increasingly over the past year or so, I've been very shocked by the way in which some media reporting about parents who aren't vaccinating their children or who are worried about vaccinating their children, the way those parents have been represented and discussed in the media. Some areas of the media, particularly some parenting blogs and some kind of, mummy media type things, where there does now appear to be this kind of real standoff between parents, a kind of aspect of a culture war maybe, which is really ridden with quite a lot of hostility and anger and castigation of the other side for their parenting practices. And from my point of view, as somebody who's interested and very concerned about the ways these kind of splits between parents emerge, because of the difficulties that creates when anybody's trying to get along with people and bring their children up, it struck me as very interesting. It also struck me as very interesting because casting my mind back to discussions of this issue some time ago, when the original controversies around MMR and autism associated with Andrew Wakefield first emerged, actually parents who were concerned about vaccination or cautious about vaccination tended to be presented rather differently. Being sceptical or asking questions about the science and what it tells us tended to attract a level of appreciation rather than condemnation. So I was very interested in the way that had all shifted. I suppose at the centre of it all, in terms of a basic question, which is the one I'm hoping that all of the panellists will address to some degree, the question that's emerging at the centre of all of this is, should vaccination be made compulsory? So should public health policy begin to adopt an approach, or adopt an approach which is now taken in other countries, to compel parents to vaccinate their children, and if they don't, withdraw various things from parents, for example, access to state school places, which seems to be the mechanism for compulsion that's been adopted. So that seems to be in the wind. So I think that's the question that's at the middle of all of this. The first speaker that we have who's going to be giving us his views is Dr. Alberto Du Bellini, who's sitting over here. He's a research fellow in the Wellcome Centre for Ethics and Humanities at the University of Oxford, but most notably is the author of a recent book called The Ethics of Vaccination, which is published by
Palgrave.
By Palgrave.
Palgrave, yes.
But is available open access, so you can buy it. It's not, I bought it, it's not that expensive, but you can also read it online through open access. The reason why I invited Alberto is because when I was trying to put this panel together, I did want to find somebody who would argue the case, and I hope this is what he's going to argue, because that's why you're here. Who would argue a case which is pro-compulsion, not because of my own predilections or views on this, but just because I wanted that case to be made. Indeed, from reading Alberto's book, his ethical position turns out being one that sustains that kind of policy approach. So he's going to speak first and set out that point of view. Our second speaker is Dr. Michael Fitzpatrick, who's a GP, but for the purposes of this discussion, most notably is the author of MMR and Autism, What Parents Need to Know, and also a book called Defeating Autism, A Damaging Delusion. I don't remember the dates when these books were published, but both an outcome of Mike's extensive involvement in the original controversies around MMR and autism, and his efforts to defend the MMR vaccine in the face of the controversy at that time. I know from what he's written subsequently that he's developed his arguments quite a lot and in very interesting ways in the face of the present discussion that we have, particularly around measles. So he's going to speak second. Now, our third speaker, Nancy Mcdermott, who's come over from America for the conference, is a regular attender at the Battle of Ideas, but for the purposes of this discussion, I invited her to speak because she's worked for, well, she's writing a book at the moment, I think nearly finished writing a book called The Problem with Parenting. So obviously that's all very relevant and I think covers all sorts of aspects of issues around parenting culture presently. But for the purposes of this discussion, she is also an advisor to Park Slope Parents, which is an online parents community. And Nancy particularly was involved in moderating the discussion. It's an enormous online community, right? One of America's largest online communities of parents. And Nancy was responsible for moderating the discussion about vaccination. I think the fact that you needed a moderator.
Nobody else wanted to do it.
Probably speaks to some of the issues that made me want to put this discussion on in the first place in terms of the types of discussions that are going on between and among parents about this issue. So that's the order in which they're going to speak. So Alberto.
Okay, thank you. So the good news for you is that I haven't changed my mind on compulsory vaccination. So I still have what I think is a good argument for compulsory vaccination, and I'm trying to present it. I think one good way of arguing in favor of public policies in general is to use analogies with other kinds of policies that are already implemented and already commonly accepted. And I think that if we use the right analogies with other kinds of policies, we can see the case for compulsory vaccination is quite compelling. So I give you an example. So I'm going to use three analogies with three different kinds of policies. And then I'll be interested to know whether you think these analogies support the case for compulsory vaccination. So suppose that there is someone out in the street that goes around shooting a gun randomly among the public, like in the square outside here. Now, this is clearly illegal in this country, and I think in any country in the world. So there is a law that prevents people from randomly firing a gun in a public space. Because if you do that, you put other people's health and life at risk. Here is an analogy. So vaccination can be seen as a way of preventing people from randomly shooting, not a gun, but infectious diseases. So if you have a virus, if you have an infectious disease in general, if you have measles, and you go out in the square, then you risk infecting other people, which means that you're putting the health and the life of other people at risk. So it's prohibited to do that with guns. It should be prohibited to do that with infectious diseases as well, because the danger for other people is not equally great, so it's more likely that you kill someone if you shoot someone in a square in London, but still, measles kills people. So in poor countries, 1 in 500 people infected with measles dies. This country is more like 1 in 5,000, I think, but still it's dangerous, and it's not just about dying, it's about the permanent damages that measles can entail, like brain damage, for example, permanent brain damages, plus the suffering involved with measles itself. So there is a law that prohibits doing that with guns. There should be a law that prohibits doing that with infectious disease as well. Now, one might object here that, well, the analogy doesn't really work because as long as in a population we have enough people who are vaccinated, then anyone who is not vaccinated is not really putting other people's health and life in danger because we have this thing called herd immunity. Okay, so herd immunity is, so very simply, is a condition, a situation where enough people in a community are vaccinated against infectious disease so that the disease cannot circulate. So it's extremely unlikely that the infection can spread. A disease like measles, so the threshold for herd immunity for a disease like measles is quite high, it's 95%. But still, if 95% of the population is vaccinated against measles, then it doesn't really matter whether the remaining 5% is vaccinated or not, because they don't represent any danger they don't pose any danger on other people. Here is another analogy when we bring in the issue of a herd immunity. So herd immunity is a public good, which means that everyone benefits from herd immunity. So those who are not vaccinated benefit from herd immunity because they are protected indirectly. But also those who are vaccinated benefit from herd immunity. First of all, because no vaccine is usually 100% effective, so you might still need that kind of protection. But secondly, because it's good for society, it's good for our community if the level of public health is good enough. So if there are less infections like diseases, because the public health system saves a lot of money from that. So herd immunity is really important as a public good. And when I say public good, I use the term in a technical sense. So a public good is, very simply put, a good from which everyone benefits, regardless of whether each individual contributes to it. Okay? So like clean air, for example. Everyone benefits from clean air, even if we don't contribute to it, even if we pollute, for example, individually, because every individual doesn't really make a difference to whether the public good obtains. So here is the second analogy, taxation. So we use taxation to make sure that everyone makes their fair contribution to important public goods, like good healthcare system, good public education, these kind of things. And the reason why taxation is compulsory is not that any individual paying taxes makes a difference. If I don't pay my taxes, it doesn't make a difference because I have an academic salary which is very low. If I was a billionaire, maybe it would make a difference, but my taxes to this country really don't make any difference. I could stop paying taxes tomorrow and this country would function equally well or equally badly, I don't know. But it doesn't make a difference. But the reason why we want people to make their contribution to public goods through taxes is fairness. Why are we upset when we find out that someone is a tax evader, doesn't pay their taxes? Well, not because we think that because that person doesn't pay taxes, therefore this country is not functioning well. It doesn't make a difference because it's unfair. And the same could be said about herd immunity. It's a matter of fairness. Herd immunity is such an important public good that it is fair that everyone makes their contribution. So there is a moral obligation of fairness, but I think there should be a legal obligation of making the fair contribution because the public good in question is very important. So whether a moral obligation should be should translate into a legal obligation depends on how important the good at stake is. And herd immunity is a very important public good because it protects vulnerable people, vulnerable individuals of a population who cannot be vaccinated, but protects everybody really because there is a benefit for the collective if there is herd immunity. So there are these two reasons for compulsory vaccination. One is harm prevention, so preventing serious harm to other people. So it's good that it should be illegal to put other people's health and life at risk. And secondly, there is an argument based on fairness, like in the case of taxation. It is fair that everyone makes their fair contribution to a public good, like herd immunity, public education, good healthcare system. So these are two analogies, so taxation and gun firing, that I think support compulsory vaccination because it's the same kind of issues at stake. Now, one objection that is sometimes raised, especially from the anti-vaxxer camp, is that, well, vaccines do entail some small risk for individuals. Not serious risks, but there are some risks of side effects, very, very small. For example, I think in the case of the MMR vaccine, the risk of allergic reactions is 1 in 1 or 2 million cases. Usually these reactions, these side effects are not life-threatening. But still, if the state coerces many people to vaccinate, say millions of people to vaccinate, then statistically at some point someone would experience some small side effect. So the argument is that the state cannot impose risks on people in this way. When there are risks involved, people should be free to choose whether or not to vaccinate, or whether or not to take on themselves or on their children these risks. Here is the third analogy I want to use, is the analogy with seatbelt requirements. So seatbelts are compulsory in most countries in the world. There are exceptions, but in this country, for example, they are compulsory, both for adults and children. And the reason is that you want to protect children and adults against the harms of car accidents. Seatbelts are very effective at saving lives. Seatbelts are used both by adults and children. No one objects to seatbelt requirements anymore these days. They used to object at the beginning when the seatbelt laws were introduced. Not anymore. Now, the thing is that seatbelts are very effective at protecting people against death and serious injuries, but there are some very, very, very rare cases in which it would be better if you didn't use seatbelts because of the dynamic of accidents. Sometimes it would be good if you could get out of the car quickly, and maybe the seatbelts might prevent you from doing that. So there is a small risk associated with seatbelts use. There is a specific category called seatbelt injuries. These are injuries that are caused by seatbelts and that will make people worse off than they would have been if they hadn't used seatbelts. There are very, very rare cases, but they happen. But still, we do think that at the population level, it's good that seatbelt use is compulsory because it saves lives. We don't use this argument based on this very small risk of danger as an argument against compulsory, against seatbelt requirements. And the same should be said about vaccination. It should be compulsory despite the very small risk that vaccines involves. So I think that these three arguments are risk prevention based on the gunfire analogy, fairness based on the taxation analogy, and the negligibility of the risk based on the seatbelt requirements, the analogy with seatbelt requirements. They all support compulsory vaccination policies. Do I still have 1 minute? Or
okay.
That's okay?
Yeah, it is just 1
okay.
minute.
30 seconds.
Okay.
So one small thing I want to say is that when I say compulsory vaccination, I mean there should be legal penalties for non-vaccination. I don't think that the US model where you exclude children from school if they're not vaccinated is the ideal one. It can work, but it's not a perfect one. Because I don't think you should punish children. You should punish parents for not vaccinating, which means you should have high legal penalties on parents, like fines. There will also be a price that parents are not prepared to pay for non-vaccinating their children. So the fine should be high enough to convince parents to vaccinate. I don't think that excluding children from school is a good policy because it will be children paying the consequences of the bad decisions of their parents, and that shouldn't be the case, really.
Okay.
Thank you.
Mike.
Thank you, Ellie. People seeing me coming in might have noticed a certain spring in my step this morning because I've had the great honour of about a fortnight ago, I had a full-page feature published in the Daily Mail. That might not have made such a big impact on attenders at the Battle of Ideas, but I can say I considered it a big boost to my ego. And the circumstance of this is people may not also be aware of it. The Daily Mail has recently launched a campaign on the issue of measles and a campaign to promote the uptake of the MMR vaccine. People with a longer memory will have noticed this very serious irony in this because 10, 15 years ago, the Daily Mail was at the head, not by any means on its own, in the campaign to support the campaign of Andrew Wakefield, mentioned by Ellie, who's first hypothesized a link between the MMR virus and autism, which has subsequently been discredited. It's been struck off the medical register. So it's a bit of an honour to me to be able to have this article, just like Andrew Wakefield, my part in his downfall, in the Daily Mail. And it cast my mind back to 10, 15, well, to be precise, 2005, not quite 15 years ago. The Daily Mail published a series of articles by Melanie Phillips, who was then Britain's highest paid columnist and still very well-known newspaper columnist. She had a series of not even just one-page articles, there were two and three-page articles, chapter and verse supporting the campaign of Andrew Wakefield. That same wasn't the Daily Mail was by no means exclusive. The same year, Lorraine Fraser won the British Press Awards, and the winner goes, the award for the Health Journalist of the Year went to Lorraine Fraser, who over the previous year had published a whole series of articles exclusively devoted to promoting the work of Andrew Wakefield. Private Eye, Britain's #1 satirical magazine, devoted an entire issue, which it never had done in any other, a 32-page issue, entirely to promoting the campaign of Andrew Wakefield. December 2003, this is a couple of years before the Mail became very much involved in this, Channel 5 produced a dedicated sort of hagiographical docudrama called Hear the Silence, promoting the work of Andrew Wakefield. Andrew Wakefield was played by Hugh Bonneville, now lately of Downton Abbey and others. Juliet Stevenson plays a doughty, feisty single parent fighting for justice with the caring, listening Andy Wakefield supporting her crusade. So that was the kind of climate of that time, which people kind of largely forgotten about now. It's just really extraordinary just how that climate has changed. One of the interesting features that the Channel 5 did get a bit of stick over this docudrama promoting Wakefield, and so they felt obliged to stage a debate on the Wakefield claims after the programme. And one of the interesting features of the debate, that debate was boycotted by the entire medical establishment. All the paediatricians, all the vaccine specialists, all decided that to participate in this debate would only give more publicity to Wakefield, so they refused to participate in it. I agreed to participate in it because I'm not a member of the medical establishment, and I was involved in this campaign because I'm a GP and I was coming across the anxieties that were generated by the scare. I'm a father of an autistic son, and so I knew a lot of parents of autistic children who were drawn into the litigation on the basis of his claims, which are manifestly insubstantial and not scientifically sustainable from the start. So I said, well, I'll go join this. And it was up to me and Evan Harris, a Liberal Democrat MP, to put the case against Wakefield, which we did as best we could on this programme. So what's interesting is that how the climate has changed. Now, all the medical, it's quite interesting, if you look at there's several books have come out now talking about this in retrospect, and the sort of medical scientific experts all compete with one another to get the most vituperative terms in which to condemn Andrew Wakefield. A money-grubbing fraudster is one of the most recent ones. A liar, a cheater, fraud. Having ignored him when he was riding high, they now compete to attack him. And that's a measure of just how things have changed. Daniel Engber wrote some quite good articles in the States about this. He makes the point how we love to hate the anti-vaxxers, that the anti-vaxxers have now become the object of public condemnation in a major way. And we see every day of the week, Simon Stevens, who's a senior figure of the NHS, seems to launch another campaign. One day he wants to ban social media websites and introduce new algorithms to exclude anti-vaxxer content. And all the big Instagram and Facebook and all these things have introduced various measures to contain it. Matt Hancock, the health secretary, keeps suggesting that there should be measures of compulsion introduced. The whole climate has completely changed in relation to this. And the interesting question arises: what has really changed here? Why is this reversal taking place? Three things I'd just very briefly like to say what are not really. One is there is no measles crisis. There's been no particular increase in measles outbreaks in this country anymore. There are outbreaks take place from time to time. They take place in particular rather isolated communities in which uptake of MMR is low for all sorts of reasons, usually because of problems of access. And people conflate that situation with reports of major outbreaks in somewhere like the Ukraine, where there's a civil war going on and a major disruption of service, or in third world countries where there has always been a high level of measles and not very well organized health services. Completely different epidemiological circumstances. So there is no particular measles crisis. There's been no collapse in the uptake of vaccines. Maybe the uptake has dropped from 92% to 90%. But this is a very small amount, and it has very, you can identify particular reasons for it. Furthermore, the third point is there's no particular evidence that there's been any great upsurge in anti-vaxxer propaganda or anti-vaxxer campaigns. We were 10, 15 years ago, there used to be big conferences going on of the anti-vaxxers. They were everywhere. They were interviewed on the Today programme in the morning, on the Newsnight in the evening. They had a high media profile. Now they can't get airplay or any coverage whatsoever. Yeah, the stuff circulates on the internet. Simon Stevens, the chief executive of the NHS, wants to de-recognise homeopathy, or the homeopathic organisms, deprive them of their professional recognition. It's like the homeopaths have always been there. It's like they're suddenly become a major problem that they've got to be dragged out and publicly executed. It's just, there's nothing new about that. It's the same old. So what I think we're seeing here, Ellie hinted at this, is that the whole anti-vax thing has become, or the anti-vax thing, to put it like that, has become tied up in this wider culture wars, where as we know, there's a sort of elite rage going in all Western societies at the moment against a populist upsurge, which seems to express itself in support for politicians that people don't like, or like Donald Trump, or political causes that people don't like Brexit, or political movements that people don't like the various populists in Hungary or Poland or Italy or in other European countries. And there's a sort of idea that it almost seems as though there's this sort of dissatisfaction that's seeping over from the political sphere into the sphere of popular culture. And this has led to this change of climate in which the anti-vaxxers have become a target of public condemnation, and there's this sort of growing chorus that something must be done about them, there must be measures taken against them, and this leads to Alberto's points about the demand for some levels of compulsion and coercion in relation to vaccination policy. I'm entirely opposed to that, because I mean Alberto even makes the point that in his book that measures of compulsion shouldn't be considered in relation to vaccination policies when other alternatives haven't been exhausted. And there are lots of other alternatives that haven't been exhausted in relation to improving the uptake of MMR in this country, which many paediatricians and vaccine specialists have drawn attention to. For example, the accessibility of clinics in the community, the level of staffing of the community, of the level of training of health visitors, of practice nurses, the availability of GPs, of GP appointments at times which are convenient to parents. Yes, particularly we're talking about follow-up second vaccines that take place in the preschool period when kids are at school, and this is a sort of the so-called preschool booster at 3, 4, 5, it's difficult for parents to get their kids to the clinic. And these are the real practical problems about improving vaccine uptake, and various practical suggestions have been made to do that, and systems for making sure parents get reminded and called and recalled if they're perhaps not aware of that. Although these measures would be very easy to introduce, would require a bit of resources, and would demonstrably improve the uptake up to a satisfactory level. So until those measures, at the very outset, I don't think it's legitimate to consider coercion. I think Alberto's analogies are highly suspect. I mean, the notion of the parallel with a shooter. I mean, shooting in a public place is an intentional activity with an extremely high level of mortality and morbidity. That is not the same as measles. Measles is not a trivial disease, but nor actually, it's important to emphasize, in Western society, is it a very serious disease. It has got, I wouldn't dismiss it as the anti-vaxxers have tended to do in the past, as an entirely trivial disease. That is not true, but neither is it smallpox or Ebola, or something which would require major coercive measures of a quarantine character or others. People are familiar with it over the years. It's a significant disease, but elevating it to a major threat to public health in this way is really not appropriate. I think the seatbelt, and just I could go through the eye, but just the seatbelt, you see, you can make a pragmatic case for any sort of, any of these measures that have been introduced: seatbelts, motorcycle helmets, default options for organ donation. But what they all do is cumulatively withdraw the capacity of people to make their own moral decisions in relation to themselves and their children, and take them over by the state. And I think that that's a terrain onto which the state should trespass with great reluctance. And what it does is undermine people's personal autonomy and their own moral responsibility. It's up to people to take their own moral responsibility in relation to both their responsibilities to the community and to herd immunity, their responsibilities to their children, their responsibility to themselves. And the more the state takes that responsibility away from people, the more it undermines the moral autonomy of the individual in a very insidious way. So I'm entirely opposed to measures of those sort of coercive measures and the school mandates for the same reason. That's what that's going to do is discourage. We're going to have lots of kids taken out of school, particularly children who more need to be in school than others. Finding parents is just going to lead to, as the tail end of the smallpox thing. You have demonstrations of thousands of people. You have lots of people being sent to prison for making martyrs of themselves, raising the temperature of this whole controversy. When actually what we need is exactly the opposite. We need to calm it all down. There's no great crisis here. There's a residual practical problems which practical measures can be introduced, and we can deal with it. And we can calm down and have sensible conversations with parents. Say, look, what are your concerns about the vaccines? How can we reassure you about the value of vaccination and how it's the best choice for yourself and for your children and for other children in society?
Okay, I can see you've got plenty that you want to disagree on. We're going to have to keep going and do that later. Nancy.
Right, well, I thought it might be useful to start by just explaining exactly how compulsory vaccination works in the states. So right now in the US, all 50 states mandate some level of vaccination for children to attend school. And what that means is that when you register for school, you have to bring in your your proof of vaccination, and then you're accepted and you can go to school. And if you don't have that, they won't allow you to register. 90% of kids are covered for tetanus, whooping cough, polio, diphtheria, measles, mumps, rubella, hepatitis B, hepatitis A, Hib, which I can't pronounce what it is.
Influenza.
Thank you. Yes. And then there are a number of other vaccines that are mandated in some states. It really depends on where you are. Some of the other things that are mandated in some places are the annual flu shot, the rotavirus vaccine, the HPV vaccine, and the meningococcal meningitis vaccine. In some places it's optional, and other places it's compulsory. Now, all 50 states also have exemptions for vaccination, and they all have exemptions for children who can't be vaccinated for medical reasons. Kids who are, maybe they have cancer, they have some sort of condition that means that it would not be safe to vaccinate them. There are a further 45 states that grant religious exemptions for people who have religious exemptions to immunization. And then there are another 15 states that will allow you not to vaccinate because you have philosophical disagreements with vaccination. These mandates originally came in, it's important to understand, not because there were loads of people who didn't want to vaccinate their kids. They came in really, the current requirements came in at the end of the 1960s when people were beginning to recognize that there was a problem with under-vaccination, particularly amongst poor children who didn't have access to facilities or to vaccination. So I have, although the federal government doesn't mandate vaccination, it does have its own campaigns. In particular, it has a thing called the Healthy People campaign. And one of the first ones, one of these was done in 1977, and it recognized that the poor are of particular concern, since survey data indicate that they consistently have lower immunization levels and higher disease incidence. And Medicaid experiences shown that even when payment for preventative services is provided, there's no assurance that those services will be used. So this was really an attempt to try and reach vulnerable parts of the population. Now, this has begun to change somewhat, particularly since 2015. And what's happened is that there have been some isolated outbreaks of measles in particular in different parts of the states. Usually it's in an isolated community like Orthodox Jews in New York State, for example, or Somalis in Minnesota. And what happened was in 2015, though, there was an outbreak in California in Disneyland, where some unvaccinated kids were in Disneyland. And I think that certainly spurred legislation in California, because I think it's conjured up the potential for a very contagious disease to infect a lot of people in a big public place like that. So what California did was they began to tighten up on the exemptions that they allowed. So the first thing they did was they got rid of the philosophical exemption, because people in California could just sort of say, "No, man, not for me," and then they wouldn't have to vaccinate their kids. But this has gone even further, because what they discovered is that the people who had philosophical vaccination or exemptions were going to doctors who were then giving them medical exemptions that weren't exactly kosher medical exemptions. In fact, there was one doctor who was found to have given exemptions for a third of a school, a third of the people who weren't vaccinated within one particular school. And so this has been tightened up on, and so last month, Governor Newsom of California signed a bill into law that would crack down on the number of medical exemptions, and just made it much more difficult to do it, so that you would have to actually specify exactly what the medical condition was, and just made it much more difficult to claim those exemptions. In New York as well, where there was just recently an outbreak of measles amongst Orthodox Jewish people in Brooklyn and Rockland counties near New York City. There was an emergency measure that disallowed unvaccinated kids from being in certain public places because of the outbreak. It also, again, tightened up on the legitimate medical reasons for people to have exemptions. And then the other important thing that they did, which is really unprecedented, was they got rid of the religious exemption for vaccination, which meant that, well, it made people in the Orthodox community very angry, even though strictly speaking, vaccination is not it's okay to vaccinate if you were Jewish, but there's some controversy, and we can talk about that later. But also the Amish community, which is up where I am, they've lost their exemption, and it's been very difficult for them because they don't vaccinate because of their religious beliefs. And the state, what it does when children aren't vaccinated is they actually fine the school. And so a school that has an unvaccinated child, if they're included, the school is fined $2,000 per student. And for a small school, that can be really devastating. And as the Amish point out, and they've actually now taken a court case, which may end up at the Supreme Court, they've made the point that homeschooling, which is what people will do if they don't want to vaccinate their kids, is they'll homeschool them, is not really an option for them because it's important in their faith to raise their children and socialize their children as a group. And so by getting rid of this religious vaccination or exemption, it really is like infringing on their right to practice their religion. And could just one more thing? Okay. And the thing I was going to say is that I think that what concerns me is that this is taking place at a time when I think parental authority is under attack more generally. And I think that this is, you have to ask yourself, is it worth it? Is having a high vaccination worth getting rid of these fundamental rights, like a right to practice your religion, the right to bring up your children the way that you want to? And I don't think it is.
Okay, thank you, Nancy. Thank our speakers. There's loads of fascinating points there, although they did all speak for too long. So therefore, what I'm going to do is come straight out to the audience, and your responses to each other, you'll have to wrap up with what you want to say.
So a lot is based on a discredited study from a long time ago. My question is really simple. Do they have any point medically? So that study, no. They're now talking about mercury, or there's a variety of things that none of which seem to make sense. Do they have any point?
You mean people who are anti-vaxxers? Yeah. Okay.
Thanks. A question for Mike. You said measles isn't smallpox, it's not Ebola. I wasn't clear whether you were saying, well, it would be okay to vaccinate in those cases. Is it about seriousness, or is it are you against compulsion full stop?
Who is the one that decides over your body, everyone present here, yourself? It's you, right? And until you're of age, it's your parent, of course. And we can also, of course, expect them to make the best decision for you because they love you, they're your parents. So who would be in a position to challenge a parent's opinion or his decision, who has the right to do that, and who is and since we do have the right to decide over our body, or in this case our parents, or the parents, who has the right to take away any right from any citizen? On the other hand, this is why I'm not really decided on the whole topic, society is made up of rules defining rights you do have and rights you don't have, which automatically makes you have some rights not, right? So there's like things you're just not allowed to do. You are restricted. Why can't we work on that? I'm not really decided. Maybe you can make something out of it.
Thanks. Yeah, my question is really, what's the primary reason people don't have their kids vaccinated? I think Alberto makes quite a good argument, actually, in many respects, and you referred to vaccination and herd immunity as a public good. You didn't use the term free rider, but I suspect what you're getting at is that people who are not vaccinated, their children have free riding. And if that's the primary reason, I think the case for compulsion is actually fairly strong. If people are consciously doing it because they're getting something for nothing, perhaps it's more of a case. However, Mike suggested maybe it's lack of access, which seems something that the government could do something about, or of course it could be, and perhaps is primarily, people's residual fear, based on the Lancet study all those years ago, that vaccines are dangerous. But if that's the case, perhaps there's a job of work to be done in educating people more about it. The NHS has a very big budget. Public Health England has a budget of £4 billion. Occasionally they will tweet something about this issue. I don't see any television campaigns trying to inform the public about the fact. So it seems to me 3 possible reasons why people are not vaccinating their kids. I'm interested to hear which you think the main one is.
Okay, do you want to come back on Mike points, whatever you like?
Yeah, so I would have a few things to say. Now, maybe I'll start with the question, then I'll go back to what Mike was saying. So I think the 2 questions which were really about ethics were the last 2. So one was about the right people have over their body. So who decides? So who takes away that right? So the thing is that there is no such a thing as an absolute right. Not even your right to life is an absolute, because people are allowed to kill you, for example, in self-defense. So every right is constrained by other people's rights and other kinds of considerations. So when there are public health considerations at stake, often the state has the power has the legitimate power to intervene to constrain individuals' freedom. For example, in the case of quarantine. So quarantine is something that goes against people's basic rights. So what philosophers would call prima facie right. So you have a right, but it's not an absolute one, and there are considerations that allow the state to intervene. And for example, individual health is another consideration. Children of Jehovah's Witnesses, people are often given blood transfusions against their parents' wishes, because that's in the interest of the child. So parental authority in this case is overridden by consideration of the best interest of the child. So all of these rights are really constrained by other considerations. And my point is that considerations about public health, public goods, fairness, and harm prevention are strong enough considerations to constrain individuals' right over their body and parentals' right over their children. Now, the other thing to say is that, so Mike was mentioning that there is no really, so the point was that this thing about measles has been a bit exaggerated. So there is no emergency in this country. It's not like going out in the square and shooting people. Completely agree on that. My point is that, well, we shouldn't really wait for an emergency before intervening. So that will be too late. So measles, maybe it has been exaggerated, but I don't remember the exact figure, but I believe in 2017, 2018, there have been something like 80 people dying of measles in Europe. Now, 80 in Europe one might say is not a big number, but it is if you think that could have been easily prevented with vaccines. So it's very easy to prevent 80. If it is very easy to do it, even 80 people is a big number. Okay, so normally we do have a moral obligation to do things that entail a very small cost to us but a large benefit to others. So there is no emergency in this country, but we shouldn't wait for emergencies. Now, about the point, there are alternative ways of realizing herd immunity, like, for example, improving access to vaccines and giving more information. This is all good. I think we should do that. But this is not inconsistent with the idea of compulsory vaccination, because all these alternatives, you could think of system of nudging. For example, you could have opt-out vaccination. So your child gets vaccinated at school unless you opt out. That might increase vaccination uptake. But there is an important point about fairness. So we want to make sure that everyone else makes the same contribution I make to the public. So this goes back to the last question. We want to make sure that everybody makes their contribution to important public goods, like in the case of taxation. And the way to do that is compulsion, because otherwise there will always be free riders. There will always, it's like in the case of taxation. If taxation wasn't compulsory, there would be so many free riders, or the state would collapse probably. And the same is true for vaccination, because fairness is important, but it's important not just in itself. So we value fairness in our society. We want everyone to make their fair contribution. That's an important public value. But fairness also has an instrumental value. So there is this problem that philosophers and psychologists often call the problem of assurance, which often arises in the case of so-called collective action problems like this. So the problem of assurance is the problem that arises because, in general, people are motivated to make their contribution to public goods only if they have the certainty or the reassurance, not the certainty, you can never be certain, but the reassurance that other people around them will do the same. If I know that you don't pay your taxes, I'm way less motivated to pay my fair share. Okay, so only if I know that enough people around me, that everybody ideally around me pay taxes, then am I motivated to pay taxes. And the same goes for vaccination. So I make my fair contribution only if I know that other people do the same. That's the instrumental value for societies of fairness. And the only way to do that is compulsion, because otherwise there will always be free riders. So people have all sorts of reasons for going against this idea of fairness. So people have moral beliefs about vaccination, they have false beliefs about the efficacy or the effectiveness of vaccines. So there are religious opposition, there is a religious opposition to vaccination. But in society, we have these public values, and fairness is the most important one. And this should override any kind of individual belief, including religious beliefs, about whether or not we should make our contribution to important public good. We are not allowed not to pay taxes because we have some religious beliefs, or say because we're against the state funding abortion services, for example. Our religious views are not relevant, and the same should apply to vaccination. So individual rights are often constrained by the public interest, and this applies to all sorts of things, applies to vaccination as well, and this applies to so-called alleged religious freedom, or whatever goes under this heading.
Okay, Mike.
Well, if I could be forgiven for saying so, Alberto, for an Italian, you have a remarkably Prussian attitude to the relationship between the state and the individual. And it seems like your instinctive response to a problem of that everybody must make a contribution to society is to resort to compulsion. Well, how about persuasion?
Because it doesn't work.
Well, on the contrary, persuasion has proved very effective in relation to immunization policy in this country. A voluntary system over the years has with a couple of very isolated exceptions, proved extremely successful in terms of
vaccination uptake for the MMR went down in the last years, right?
It went down 10% in response to the Wakefield scare. Since then, it's gone back up again.
In the last 5 years, it went down.
In the last 5 years, it's gone down about 2%.
Well,
which is
something.
A very small,
very small 2%
amount,
makes a
and
difference.
It's something which can be, as I said, there are very simple measures which could be taken to tackle that. So I think, rather than jumping for the gun, let's calm down and try persuading people first of all. And I think that's the whole problem. That there can indeed be cases, if the public health argument is strong enough, for measures of coercion. To come to the question here about the seriousness. The seriousness is an issue. That's about if you've got a disease like smallpox or Ebola. I agree with Alberto's point. Quarantine measures are very coercive, but they are justified in response to the seriousness of the threat to public health. the seriousness of the threat to public health does not exist in relation to measles in the United Kingdom. We're talking about the policies of this country at the moment, which is why introducing the death rate in Europe in relation to it is entirely illegitimate in this discussion, because these deaths from measles are taking place in Ukraine, in Romania, in Albania, in countries where
Also in
there is
Italy.
either civil war going on or there is a very disrupted health service for one reason or another. So, you know, that's entirely, or you have to raise respect at measles. Okay, it's not too bad at the moment, but it might get very bad. Well, why should it? You know, we're very familiar with it over a very long period of time. It's rippled away. Mercifully, because of the success of MMR over the last 30 years, it's become a very marginal problem, apart from in very isolated cases of which Nancy's given some examples. Just a couple other points that were raised. Is there any point to the anti-vaxxers? I think one thing that a hypothesis that has been tested to destruction is the relationship between MMR and autism. You know, that is because of the whole Wakefield scare. It's been the subject of an enormous amount of research in epidemiological studies, in clinical studies, and I think as far as you can establish any scientific certainty, it's categorically clear that that hypothesis has not been supported. And you know, Wakefield himself and his supporters have never substantiated their own hypothesis. It's true then that the thing shifts on. You raised a point in the States, the issue of mercury in vaccines has been raised. As it happens, that has also faded because the vaccine, the mercury has been removed from the vaccine. Mercury was used as a preservative. People may not be familiar with this thing. It was a big thing in the States. Very trace amounts of a mercury preservative were used as a disinfectant in vaccines because of problems that happened many years ago. This was alleged in the States to be a factor in causing autism. That also, the mercury was removed from vaccine on a precautionary principle basis, and lo and behold, it had no effect whatsoever on the autism prevalence, which was growing for other reasons, mainly a growing awareness and recognition of autism among public and specialists alike. The mercury thing being discredited, then it moves on. There's another school of thought now, so it's all aluminium. Traces of aluminium preservatives are used in the preparation of some vaccines, so aluminium. And of course, mercury and aluminium in high doses are toxic. Toxic metals. So, you know, there's always some rational kernel in these arguments, but the idea that they are a significant factor in causing adverse consequences of vaccines is not scientifically sustainable. So I think that's, yeah, perhaps there's
okay.
lots of points.
I know there's more to come over here, but we'll keep going. Nancy?
Well, I mean, the thing that worries me about the situation that we have in the States now is that I learned pretty early on, moderating these discussions, is that the reason why parents don't vaccinate their kids is because they want to do the best for their child, which, you know, is reasonable in one sense, but when they talk about their child, the anti-vaxxers want to do the best for their child, but then you have the very extreme pro-vaccination people who want to do the best for their child and are pissed off with you because you won't do the best for their child. And what is not going on in that discussion is any sense of a common good. There's no sense of a public good. It's just my interests versus your interests. And you know, and by God, I'm going to make sure that, you know, I enforce my interests against you. So I have a friend who's a pediatrician, and she said that she used to get questions about the safety of vaccines and all sorts years ago. But, you know, for the last 10 years, the main question people have asked her is, how can I find out who's vaccinated and who's not in my kid's school? And so, you know, what you've created is we've created a real sort of parent against parent situation where there isn't a sense of all being in it together. And now with these new measures, we're creating a sort of a situation where you have the state against parents and where you're undermining parental authority. And if in the case of New York State, it's really extreme because, I mean, in New York State now, they even mandate they mandate the chicken pox, which is kind of, you know, it's somewhat effective, but, you know, should you mandate it? I don't know. They also mandate the flu vaccine for kids to go to preschool. And when you think about a flu vaccine, which can, 1 year it might be very effective, 1 year it might not be very effective, is it really worth excluding kids from school because they didn't have their annual flu shot? And so I think, I think there are trade-offs with this, and I think that it's an easy answer just to try and force people to do something when really what you need to have is a moral argument. And the other thing I'll just add to that is what I have found in dealing with parents who don't vaccinate their kids is sometimes if you just say, look, okay, I understand why you don't want to do that, and I respect your right to make that decision for your child. It's really interesting what happens, because then it's kind of like you repose the discussion, they kind of relax, and there are several people I know of who now are vaccinating their kids because they just had the time to reflect, and it didn't become this great kind of us versus them thing, and it became a much more reasonable discussion where you could actually get somewhere.
Okay.
For Alberto, we don't want to punish the children, so we'll fine the parents. Well, actually, if you're in a poor family, that will punish the children. If you're in a rich family, it doesn't make a ha'porth of difference, you just pay the fine. So it won't work, just as it didn't work with smallpox vaccination in this country. If I wanted to introduce a drug, I would actually have to show that it worked and was safe. You have to prove that compulsion wouldn't do any harm, and I would suggest it would do harm. Trust the poorer parents suffering most. And to be even-handed, for Mike, a fall of only 2 or 3% in MMR uptake is quite significant. We don't have a big problem with measles, but the 4 deaths we've had with measles in the last 15 years, 2 of them were immunosuppressed people who couldn't be given the vaccine, and 1 was in a 10-month-old child. So they would have been relying on herd immunity, which we didn't have. And just as a last thing, I'm not usually called a member of the medical establishment, but you did seem to include me when you talked about the people who boycotted the ITV programme. I would suggest that it did work because it got very little publicity.
I think now you've got parents whose child has been damaged by a vaccine, or some of them are those people, labelled anti-vaxxers. They're not campaigners, they're not ideologists, they're not political activists. They're a parent whose child was damaged by a vaccine, and the media aren't allowed to interview them. So a friend of mine on a national newspaper sent me a feature, very proudly saying, Fiona, you're going to love me, I stopped this feature. So I said, good for you, good for you. He said, it's full of anti-vaxxers. I read it, it was actually, you two were in it, quoted all over the place. Fantastic experts on both sides. It was a long-form feature, but it had interviewed some parents whose children had been damaged by vaccines. And he had fought the editors and said, we will be crucified, we can't include this. So that I just think is really scary. I set up the Science Media Centre to persuade scientists to engage in these debates, embrace public concerns, address these concerns and engage with them. And scroll forward 18 years, I'm now increasingly being asked by this same scientific community to shut down, get rid of climate change skeptics off the airways, get rid of anti-vaxxers from being even spoken to in interviews, rather than engaging and embracing these debates. It's like if they don't speak the science language, if they're speaking another language, then they have to be closed down. So I think there's something just really uncomfortable going on here. I think we need to engage with these debates and persuade them. And that's what I think scientists like this have been doing for 20 years.
Okay.
Thank you. So I'm quite interested about the comment at the beginning that suggested a concern about opprobrium and the attitude around the anti-vaxxers. I think there is a place for society to think that choosing not to vaccinate your child as a personal choice is not a good place to be. I think if you look at what's happened with drink driving over the years and how societal pressure to reduce the levels of drink driving has had an impact, I think we need to say something of that coming through as well with vaccinations. There is some evidence that there is freeloading going on with anti-vaccination. Surrey is the county that has by far the lowest rates of vaccinations. It's one of the top 3 health priorities in the county. And it is not a county with problems of access or problems of education or problems of deprivation. So we are seeing some of this freeloading attitude coming through and people choosing not to vaccinate. And I think it is perfectly legitimate for people to say that if you have chosen not to vaccinate your child and they could have been vaccinated, you are putting at risk the health of other children who are immunosuppressed or who are too young to have the vaccination. And I think there is a valid place for that. You
sound like you might be a GP or a nurse.
No, I'm not a clinical background, but I was in NHS senior management.
And do you, in terms of you saying this thing about free-riding parents, I mean, in terms of what you think they're doing, you think they just have no reason other than they can't be bothered?
Or aware of herd immunity and taking the decision that it won't make that difference, so I'm not getting my child vaccinated because it won't make that individual difference.
Do you think it's just because they can't be bothered, or?
No, I don't think it's that they can't be bothered. I think it is. It's a little bit of uncertainty around it. It's also a little bit of the challenge of doing it, but it's also the fact that taking a child to the GP is not a pleasant thing to have to do, and people aren't 100% sure of what the consequences of vaccination are going to be at an individual level.
I do think this thing's interesting, and I mean, we can keep going on anything, but in terms of one of the things about parents and mothers in particular, and the extent to which you being encouraged to never ever do anything which could possibly put your child at risk or take any risk, and also to mothers being encouraged to do things that are as natural and non-invasive as possible, which have now become very, very powerful messages communicated to mothers. I do wonder whether there's anything to do with the difficulties of then getting that to hold together with having somebody stick a needle in your kid. And I wonder whether it's what you say about.
And there's a different attitude. I happen to be living in France at a time when my children were going through the whole vaccination period, and I was alive to the debate because it was in the early 2000s, so I had lots of friends over here. I went to my GP in France and said, well, what about having individual vaccinations? Would you offer that? And he said, no, I wouldn't. That's tantamount to assault. I'd be sticking a needle in your kid 6 times and I could do it twice. So if you want me to do that, that's fine. Find another GP.
I'm also a GP, and I found over the years that if you communicate well and you have a good functioning GP practice with easy access, then you can keep vaccination rates up, to a very good level. And I think a lot of the problem is that the community services have been fragmented in recent years, that child clinics have been closed down, there's been a decrease in funding of school nurses and other community services. And I think this is one of the reasons why the vaccination rates have dropped. The fact that most or a higher percentage of parents get the first MMR done, but then don't get round to doing the preschool one, would suggest that it's not anti-vaxxers. It would suggest that it's maybe the fact that they maybe haven't got time, or they don't want to take the kids out of school to get the vaccines. And I think those are the things that we could tackle to improve the vaccine rates.
This is just a really quick point, which is that something that's been bugging me about this, and I think I've just worked out one of the reasons why it's bugging me, is that if the risk for anti-vaxxers is that they might, and I know that this has been scientifically discredited, but they might possibly get autism or be autistic in the future, are we not then placing autism kind of as being commensurate with a life-threatening illness? So does that not say something more about how we're understanding a condition like autism than kind of anything else?
So Nancy.
I think that I think it's really worth listening to people who don't vaccinate. I think that what was said in the audience about the problems of excluding people like this from the discussion is really true, because often what I found is that in in some cases, it's usually something has happened, like someone in their family happened to get sick after being vaccinated, and maybe it was vaccine related, maybe it wasn't, but these are real fears, and they need to be respected, and they need to be taken seriously. And I think that it's just if we're going to convince people, we have to keep from demonizing them. And I think the first step in that is to recognize that people have that we all have an interest in caring for our children, and that's a bit of common ground. And I think if we did more of that, and tried to avoid the kind of us versus them way that this discussion has been posed, I think it's entirely possible that we can convince enough people to vaccinate where we can respect religious freedom, and where we can also protect people who can't be vaccinated.
Mike.
The comment from my GP colleague at the front, I think I would endorse absolutely. And I think what it also draws attention to one of the key problems, I think, of primary care. I mean, people, I think, probably underestimate the extent to which primary healthcare is in a state of some crisis at the moment. And one of the problems is that there's a breakdown in continuity of care. And one of the key factors I was in the same practice for nearly 30 years, and you could feel that parents would come to you because you'd known them all their lives, and they would accept your on the basis of trust, and you had a long established relationship with them, and the same with people's relationship with other nurses and health visitors around the practice, and those key relationships have been seriously undermined in the last few years by all sorts of factors, but it's made it very difficult, and I think that's undoubtedly one of the factors that's undermined this, has contributed to the problems of uptake. On the issue of the seriousness of measles and the question of the seriousness of the fall in uptake, I find myself shifting a bit, because 10-15 years ago, when the anti-vaxxers were in the ascendancy, and they were very much arguing measles is not a very serious disease, and we all had it as we were kids, and we would minimize it, and the rate of complications is not all that good. One would bend the stick, as the old leftists used to say, to say, well, actually, it is quite serious. It has a significant incidence of complications. If you've got a significant sized outbreak, you will have a small number of deaths. One would emphasize that side of it. We're in a different situation now, where there seems to be a tendency to inflate the seriousness of it in order to justify more coercive measures. And so I don't underestimate that. The point was made here that there's a small number of deaths over the last 10 or 15 years, particularly of immunocompromised children, that indeed the fall of 2 or 3% is not to be dismissed. But the question is, does that justify coercive measures? That's the really subject under discussion. And I would argue, I think Alberto is arguing that it does. I would argue that it doesn't. On the contrary, it argues for the sort of practical measures that we've talked about. And so, I'm inclined now to make that point, that it's not measles is. One of the interesting things about my article in the Daily Mail, actually, the only thing they changed in the article was I put the point that measles was not a trivial disease, and they changed it in the final version to measles is a serious disease. And that reflects this change. The Daily Mail is suddenly very keen to promote the idea that it's a much more serious problem. I think the thing about any link between vaccine and autism, autism is not a life-threatening condition, but I think most people would look to their babies and would rather not that they were autistic. I'll leave it there.
Okay.
Okay, thanks. The thing about compulsory vaccination being more of a burden to poor people than to rich people, I agree on that. That's a problem of all most compulsory policies. Speed tickets, parking tickets. Of course, if you're rich, you say, okay, I do that and I pay the fine. If you're poor, you can't do that. But the thing is that with vaccination, so this unfairness of placing a higher burden, like a larger burden on poor people. So the worst thing that can happen to poor people is that they vaccinate their children, which is not at all a bad thing. It's not that we are punishing them. So if poor people are penalized because they are forced coerce into vaccinating their children because they don't have enough money to pay the fine, if that's your problem. But that's a good thing, right? Because if a child is vaccinated, so should we get this clear? If a child gets vaccinated, that is a good thing. If you pay a large fine that creates problem to your family because you don't want to vaccinate your child, it means you are not a responsible parent. And there may be all sorts of reasons for that. You don't have, like, you don't go looking for the right information. But, you know, the main point here is that we should protect children and we should protect public health. We all agree on this. So regardless of our positions about compulsory or not compulsory, vaccines are a good thing. They're safe. They're effective. So responsibility should take correct information into account, right? So you're a responsible parent if you go looking for the right information. So this goes back to the other point about vaccine injuries, or I don't know if this is the expression used, I don't remember, sorry if this is the expression used. So what I wanted to ask is what kind of damage you were talking about and what evidence do you have for that? Because in my experience, often anti-vaxxers tend to confuse correlation with causation. So sometimes injuries are attributed to vaccines when they are not. So it wasn't very clear. Well, we don't have time to formulate, but so vaccine injuries are extremely minor compared to the injuries and the potential complications of infectious diseases. So we shouldn't forget that there are risks involved in not vaccinating your children. We always talk about the risks of vaccines. What about the risks of not vaccinating your children? Now, this has to do with some bias that often people have. So what psychology called omission bias. So people tend to feel more responsible for bad outcomes that are a result of omission, of not doing anything, than for the same outcomes that are a result of action. Okay? If you do something and something bad happens, then you feel more responsible than an equally bad outcome than you will feel if an equally bad outcome resulted as a result of omission. That's how human mind works. That's irrational. It's a bias we have. But that shouldn't really inform public policy, because ultimately what matters is that we have a good level of public health and that children are protected. And the way to do that is through vaccination in the case of infectious diseases, because vaccines are safe and effective. Actually, much safer than getting an infectious disease. Okay, so it's much safer to get vaccinated than to get measles. That's one of the reasons why people's religious views about vaccines shouldn't really matter for the sake of policymaking, because what is at stake is so important. So religion is the sphere of private beliefs, private morality. It has nothing to do with implementing policies that further important public goods and public values, at least in secular societies.
Okay, this obviously be really interested to know people's responses to this idea then that if science establishes that something is true, that means that people's behaviour should necessarily flow from that in certain conditions, and that then becomes something that should be subject to compulsion, and that overrides an individual's religious belief. So, and I also wonder what anybody thinks about, including the panel, about other vaccinations like chickenpox, flu, anything else, HPV. Do we pursue this logic with those?
So we've discussed the fact that under-immunisation is due to lots of factors, and we know in this country it's mainly due to lack of access. So if we improve that, things would improve a lot, and issues around general practice. But this idea that parents who reject vaccination are poorly informed or haven't thought about it in depth is completely naive. I mean, studies in Australia show that these groups of parents have put a huge amount of thought into this, and they are often extremely well informed. So the idea that it's a knowledge deficit that makes you not vaccinate your children is just crazy. It's not the case. They put a huge amount of thought in, but it's a whole different perspective on health and wellness, and it's just not following the traditional line. So I think we have to be very conscious of that just throwing a load of information at parents is not going to make a difference to a lot of parents. I don't like talking about educating parents because I think that's very top-down, gives the wrong impression. But I think what Mike was saying, what the other GPs were saying, that the key here is about trust. If you trust your health provider and you can sit and have these conversations and they can work through your concerns, that makes a huge amount of difference. The trouble is that we're on our uppers in terms of the number of people that can do that, because general practice is so pressured at the moment.
Okay, so I just wanted to say something about whether or not religion should be a factor when considering policy issues, particularly in healthcare. And I'm coming from a background where I ran a faith-based organisation that was looking at religion, healthcare, and ethics in the UK for the last few years. So a lot of this is just from experience. I think communication can go a long way. Different religions may have different issues with vaccines, so it's often helpful not to lump all of different religions together. Sometimes it could be an issue of risk that's involved, at other times it could be the ingredients that are used in vaccinations. It's probably really useful to open up that space and try to understand what those concerns may be, because they may be concerns that we can collectively overcome in fairly simple ways. The issue of health literacy amongst religious experts who are often issuing guidance to the public is something that should be addressed. So if we can have better communication to work with religious experts to help them understand healthcare issues as well as risk, but equally on the other side, faith and religious literacy for healthcare professionals so that they're better equipped to address the needs of the people that they're serving. Framing and language is another issue. So this concept of public good exists across many religions. It doesn't necessarily have to be that we only use the concept of public good coming from a secular state perspective. If you can monopolize on the existing principles within different religions, I think that can build a lot of momentum behind an issue that everyone would really buy into.
Well, a question for the panel about what you think we could do going forward as a compromise, because I think in this kind of issue, or any issue, at the end of the day, you have to find a middle ground to go forward. So that would be what I wanted to think about. But to put myself in context, I have a 4-year-old son, unvaccinated. I'm not an anti-vaxxer, I have a science background. I'm not uninformed. My wife is from Italy, and her family from Italy. None of them are vaccinated, and they are very much anti-vaccination in a sense. But we didn't vaccinate our son, not so much because of fears of autism and stuff, although he does have symptoms of Asperger's. Nothing to do with vaccine. These symptoms tend to come out at a time when people have just had vaccines, so it's more of a correlation, not a causation. But we didn't vaccinate him, in my mind, because of this NHS schedule was so extreme. There was so many vaccines that we had to pump into our son at such a young age. Before he even got out of the hospital the first time, he was supposed to have 2 or 3 of these vaccinations. And his body just, I didn't feel was ready for it. I mean, this newborn baby being pumped full of these chemicals and vaccines, I didn't agree with that at all. And the schedule was so many of them to be done, and in multiple shots, if you like, like the MMR, etc. I just felt it would have been better to have them done individually, as we decide to do them as his parent, in his best interest. And I'm not against getting some vaccinations done in the future, but at this point, I think his body's ready to take some of those things. And things like whooping cough, there was such pressure to have whooping cough vaccination from all the medical staff. And I understand as a public health issue that's a solution, but on an individual level, he didn't need that whooping cough vaccination. So there's a difference when you look at something on a public health level, general public, like what you're talking about on the end there, and when you're looking at individual issues. So
Okay.
The other bit was, about the amount of deaths from, say, measles. They're not insignificant, but I don't see the same kind of draconian measures being put in place about air pollution around schools, for example. And it's come out lately that the air pollution from SUVs around the world in developed countries is worse than those from airlines, for example. So the air pollution locally around schools is caused a lot by traffic. And there's something like 800,000 deaths a year about that.
Really interesting hearing about how people who don't vaccinate may not be anti-vaxxers. Thinking back to what Mike said about this whole conversation getting bound up with leak rage about populism. You know, you can see in all kinds of areas of life, middle classes projecting their fears about the worst instincts of the public onto the public. Are they doing the same thing with anti-vaxxers here? Is the anti-vax thing a phantom menace?
Okay.
I wanted to know about the processes of compulsory vaccination, because it seems that everybody agrees to conform to the case of yellow fever. We have to get the international carnet. So I don't know who decides this,
Okay.
and who makes it to be respected at the border, because everybody seems to agree with this.
Okay.
Thank you. I'll be very brief.
Okay.
Alberto says that 2% is significant enough to necessitate compulsory vaccinations. You would say it's not significant enough. Can we just get agreement that if it was 20%, 30%, 40%, there is a figure at which compulsory vaccination is absolutely essential?
Okay, that's it. So do you want to start first with the summing up then?
So there are so many issues. I will not be able to touch
pick
on
one, yeah.
all of them. Yeah, sorry. I will try to cover a bit of what very quickly. So it's true that parents who don't vaccinate often have a lot of information. So it's also in the US. So parents who don't vaccinate tend to be highly educated, white, middle-class people. That's true. And so according to what you said also in Australia, problem is, I think, is what we consider to be information. So these people are people who know a lot about the claims around vaccines, but the problem is filtering out the true from the false claims. So you use the word information, be informed, but be informed means knowing things that are true. So these people know a lot of the claims, but not often they can tell what is true and what is not. And that's, I think, is the main problem. But it's true that they know a lot about the debate itself, not so much about science. But the thing here is that we should give these people the right information in the right way. So the word trust was brought up in one of the interventions. That's very important, because the way you can convince people to, you can make sure that people use the right information, use information as opposed to false claims, is to make sure that they trust the people who give them the information, so the healthcare system. That's not incompatible with compulsory vaccination. Compulsory vaccination is also about something else. It's about raising uptake while we do this work. Because while we do this work of enhancing trust, vaccination rates are going down. So we need to do something at the policy level. And then we also need to enhance trust and all these things. That's very important. And there's an issue of fairness about that. Like any public policy needs to take fairness into account. The place of religion, well, again, that's true. The concept of public good is not, I don't know how different religions use the concept of public good, but we live in secular societies. We need to use the secular concept of public good, which requires people putting aside their personal beliefs for the sake of public values that are important, like fairness and not harming other people. So religion it's okay if there is an internal discussion within religions about the place of vaccines according to their moral views, but that has nothing to do with policy making. So some religions are okay with vaccines, some religions are not. These are internal disputes of religion, but when you implement public policies, those internal debates shouldn't really matter. And the last thing is about, so I mentioned before science, so that's what matters really. So this idea that your child was supposed to have too many vaccines, well, the NHS schedule is based on science, on evidence, on what is good for the individual and for public health. So the amount of vaccines recommended by NHS is not really too much. Many people tend to believe that, but there is such a thing as too many vaccines in the current schedule of the NHS, because there is no real danger in getting that amount of vaccines at the same time. So, but that's something which there should be a dialogue, and we should enhance trust in the dialogue between healthcare providers, the NHS, and the public about this, because this is really the problem. Not so much anti-vaxxers, but people who are a bit hesitant. So you're not opposed to vaccines, but you're a bit skeptical, and that's so this is the kind of thing we need to work on. So to have the communication and to make sure that people don't think false things about vaccines.
I can't see this dialogue getting off the ground.
No, we should. Yeah. Should have another one for next year.
This is a dialogue between the Oxford Department of Moral Philosophy and the baby clinic, and I don't think it just doesn't connect. I'm very sympathetic to this. If you're down in the baby clinic, it is extraordinary the number of vaccinations that kids have, and parents are very understandably apprehensive about their precious baby, to bring them along for this extraordinary program of vaccinations, which increases all the time. And one of the problems of general practice is to try and keep up with the changes of the vaccine schedule is a very difficult job. You've got to be looking it up all the time because it's changing all the time. And it's a problem because, you know, your apprehensions, I think, are entirely understandable. And I think we've got to create an atmosphere and a climate within the clinic where we can talk about these things. And threatening you with litigation and coercion is not going to help. You know, and on the contrary, it's going to be have the opposite effect. At the same time, you know, I've been in general practice for 30 years, and you look back. I mean, one of the things that's so striking about you know, sitting in a GP surgery is people bringing their babies and their young children in, and just how healthy they are. I mean, it's one of the delights of general practice is seeing healthy babies, thriving, flourishing babies all the time. And people bring their babies, you know, with anxieties about it. There's very rarely actually anything wrong with them. So it's one of the great delights of the day, you know, it perks up your day. You see all these miserable old people, and then you have these delightful babies to chat with, you know. So, and one of the overwhelming, and this is what you're aware of, is the tremendous contribution to that situation that the childhood immunisation programme has made. And, you know, we're in a situation where there are certain problems with it that we need to tackle. And there are, you know, lots of things that we can do to tackle it. Threatening people with the law is not one of them. Threatening them with law courts, banning their children from school, it's just not going to help in the slightest. There are lots of practical things that we could do. I know I stung my friend up here about the old debate with Wakefield, but I do think the issue is, you know, it's not a question of whether it gave him publicity, it's a question of engaging in this dialogue and engaging in debate. And you look at, again, the Simon Stevens and Matt Hancock wanting to clamp down on all these websites. I noticed this thing they're saying that with the Google and Twitter and Facebook and Instagram, we want to make sure people get the right information. Well, I don't want Matt telling me what the right information is, you know. I think we can leave people to work that out for themselves, and that sort of trying to tell people what the right information is just counterproductive.
Okay, Nancy?
Well, one of the things that we haven't talked about very much, but I think is worth mentioning, is that it is actually kind of unusual that parents are doing all this research, and that parents are so feel that it's their sole responsibility to touch every aspect of their children's lives, because it's not just vaccines that parents investigate. It's cribs and sunscreens and, you know, and all of these things. And I think that, you know, part of the problem that we have is that the way that parents are now is a reaction to a loss of a sense that we're all in this together, and a feeling that it's down to you to protect your child. And I would submit that the moral argument that we need to have is that ultimately you can't protect your child alone. To raise our children, you know, to be healthy and to have good lives, we need to have this be a collective thing that we do together. And I think that there is room in that for recognizing parents' right to raise their children in their faith, just as there's room for allowing medical vaccinations for children who can't be immunized. And I think, you know, that's the sort of opportunity here, is to be able to repost this discussion and to be able to come to some collective agreement about, you know, what we think is worth defending, you know, what we think is a public good. And I would say that, you know, allowing parents to, you know, to raise their children in the way that according to their own conscience, I think that is a public good in itself, and I would really hate to see that overturned by coercion.
Okay. We thank our speakers. Thank you.